There are many ways of approaching breast imaging, and because there's so many technologies, people get confused.
This is going to come up one more time, okay?
The standard screening method for women is the X-ray imaging of the breast, or mammography. Mammography is fantastic at identifying little tiny white dots on a mammogram, which represent calcifications, the earliest stage of breast cancer. A weakness of mammography would be in the setting of a woman who has very dense breast tissue. And that's because dense-breasted women have mammograms that are almost entirely white. And so cancer, which is also often seen as a white abnormality, is harder to detect. That said, it is still a very good test for screening all women and has been shown to reduce mortality from breast cancer.
Another way of looking for breast cancer is with breast ultrasound. Although mammography can find many breast cancers, sometimes ultrasound actually will find others. The problem is that it will miss those little calcium particles. Now there's other ways of looking at the breast besides mammography and ultrasound. One is MRI. And MRI uses strong magnets to look through the breast tissue, and they give contrast in the arm. And what happens is that those cancers will light up bright, and so it will show us little cancers that can't be seen any other way. But I ought to say, you can't just get the MRI. And the reason is because it will miss the earliest form of breast cancer shown by mammography and calcifications.
We'll take this lateral picture.
There's a new technology called 3D mammography, or also called tomosynthesis, and it's something that we've just recently started offering at Stanford.
Take in a breath and hold it.
In the early clinical trials, the data has shown that this new technology decreases false positives and increases cancer detection, regardless of a woman's breast density.
The way that you take tomosynthesis is the breast is compressed, and then you have extra pictures taken like this. The images will produce little areas of pictures through the breast so that we can see every little bit of it. And it's been shown in studies that tomosynthesis can increase the detection of breast cancer by about 25 to 27%. That's huge. Plus, it decreases the number of false positives between 15 and 17%.
Recommendations for screening are generally based on a woman's risk for breast cancer. Various factors play into a woman's risk for breast cancer, including her age, her family history of breast cancer, family history of ovarian cancer, her breast density, and then any genetic predisposition to breast cancer, such as a BRCA mutation.
At Stanford, we're going to use all of our technology, all of our research, all of our experience to try and do our very best for every woman to find breast cancer early and cure it.
My name is Trish. I'm a Coastal Medical patient, and I was recently invited to take part in the annual wellness visit. I did not know what a wellness visit was. I received a letter, and it explained that it's an opportunity to meet with a nurse practitioner and a pharmacist and to ask questions and to be evaluated. And I thought, why not? Why not take advantage of something that is being offered, that is not going to cost me anything, that is not taking a whole lot of time out of my life to benefit me? This visit was different than my annual visit with my doctor because it's not a medical atmosphere. Yes, they do a couple of exams like blood pressure and checking the bottom of your feet for any neuropathy, but it was a more personalized visit in that I was able to ask questions and get some answers that I wouldn't have time for at a doctor's office. I came in and I checked in at the window and I had my paperwork already filled out because they mail it to you. My wait time was less than 5 minutes, and I was greeted by the first person who would interview me, and that was the medical assistant. I met with the pharmacist who goes over all of the medications. You are asked to bring your medications in, and they go over everything to make sure there's nothing conflicting with something else. And that was very interesting because I did learn a couple of things about my own medications that I had not known before. And after the pharmacist is finished, then you meet with the nurse practitioner, and she or he goes over everything regarding your health in general. And that was basically it. It was done, and it was probably an hour of time, and very worth it. I most definitely will be taking part in that every year.
The reason that we're doing this video is because we really wanted to explain how important our new annual wellness center is for our Medicare patients.
So these visits are very valuable to your doctor. They inform your doctor in advance of your upcoming visit what tests have been done, what screens have been done, and what are going to be concerns of yours that you can directly address with the doctor.
Doctors love this because when the patient comes in for the visit following the annual wellness visit, the physician is completely prepared.
The beautiful part about these annual wellness visits is they are performed by Coastal colleagues. They are performed in the same electronic health record. And we can pick up the phone, and do pick up the phone, and call your doctor to say, we found this at our annual wellness visit. You'll be seeing this patient in 2 to 3 weeks for a checkup. We want to keep you informed. So your participation in these visits helps your doctor deliver better care for you.
These annual wellness visits are for Medicare or Medicare Advantage patients. These visits are free of charge.
One of the important conditions of the colon that is largely preventable is colorectal cancer, which is one of the leading causes of cancer-related death in the United States. And we know that screening for early cancers or for polyps, which could turn into cancer, can have a profound impact in decreasing death from colorectal cancer.
One of the challenges we face when we think about screening tests is that many people leading their daily life don't want to think about the possibility of colon or rectal cancer, and they may believe that because they feel well, there's absolutely no chance that there's anything wrong.
But polyps and early tumors are often not symptomatic. That is the whole reason that screening is instituted in people without symptoms.
If we find a tumor before it has caused symptoms, it's much more treatable, so the cure rate is much higher.
The idea is that you want to go in at least 10 years before a problem is going to occur. So typically the peak years for colon cancer to develop are in the 60s, and that's the reason we start looking at 50. Most cancers don't arise out of the blue. They usually arise from polyps that have been growing for a decade or more. And the idea is if you go in at the age of 50, the procedure is going to pick up at most small polyps that are easy to get out. Small polyps also associated with low complication rates as you remove them.
So if you're 50 years of age or older, you should have your colon evaluated with the colonoscopy. There's just no reason in the world to put it off. It prevents colorectal cancer. Everybody talks about how horrible it is, and they put it off and they put it off and they don't do it. The fact of the matter is there is nothing wrong with the colonoscopy. You are not aware when it occurs. When you go to your colonoscopy, they give you a little sedation, and the next thing you know, you're waking up saying, are we done? So the part that people say, well, the unpleasant part is the bowel prep. The bowel prep is only unpleasant if you decide to take the bowel prep and then try to go to a movie. You should take the bowel prep and stay near a toilet, and then when you do that, it cleans you out and it is no big deal.
Typically, if you find the colon's normal, a patient does not need to come back for repeat colonoscopy for 10 years. Now, that's a long period of time. So it's really important the endoscopist gets to see every bit of your colon. And that's where it's very, very important to have a very clean colon at the time of your procedure. So one of the things we do a lot of is we get referred a lot of patients who failed colonoscopy on the outset for various reasons. And so we use a multitude of very specialized techniques out here. And we also have some very special scopes. one in particular that has a very short turn radius, so it can turn on a dime, and that scope really allows us to get through very complex fixed colons with ease. And so we succeed in almost every case that has failed on the outside. This is a world-class unit, really, and all of our people, physicians and nurses and technicians, are really dedicated to providing patients with the best possible safety, comfort, and experience overall.
In the older population, we're seeing colorectal cancer incidence go down. We think that's in large part due to screening.
The hope of public health efforts to increase the rate of screening, as well as efforts to improve the technology that we have available for screening, is that one day colon and rectal cancer could be a rare disease.
There are two new programs for Hattiesburg Clinic that we offer our patients now for traditional Medicare patients. One is called the Annual Wellness Visit, where a patient comes in once a year at no cost and has a wellness visit screening done with a highly qualified nurse. The second program is called the Chronic Care Management Service, and that is provided with a phone call interaction between the patient and a nurse who works for the primary care physician. And it really helps keep the patient and the physician more engaged on a regular basis outside of what's already happening in the office. The annual wellness visit is a once-a-year visit with a nurse, and the focus is really on disease prevention. So really trying to identify problems before they're really known. So really a focus on screening, cancer screening, depression risk screening, screening for a risk for falls, and really a focus on trying to keep the patient healthy as best we can. The Chronic Care Management Program is a new service to Medicare patients where we are able to reach out to the patient at least once a month with a highly qualified nurse who's interacting with the patient on a regular basis outside of what's done in the office with the physician to keep connected with the patient, really focusing on diseases. So, for instance, if a patient has hypertension and diabetes or a patient has COPD and depression, we can call that patient once a month, at least once a month, and interact and make sure how well they're doing so that we can keep things on track in between office visits.
During the nurses' communications with their patients, they may determine that there are issues that need to be addressed by a physician or other healthcare provider. In this case, the chronic care management nurse will contact the primary care office to help coordinate the patient's needs in a timely manner.
The chronic care management program costs about a little less than $8 a month per patient, assuming that is not covered already by the secondary insurance. A consent is required between the patient and the physician in order to provide these services. These programs have been great for our patients and great for our physicians because they really are they're a way that we can keep our patients and our doctors connected, so there's more interaction in between office visits. So if a patient's seeing the doctor once every 3 months or every 6 months, we're able to check on that patient more regularly than that so that we can identify problems before they get too far off track and get the patient back in sooner if we need to, or just have that interaction to let everybody know that everything's going okay.